Well, good morning, everybody. It is my distinct pleasure to be here with these esteemed leaders to talk about some of the initial factors, contextual factors, dynamics that are being put in place to kick off this incredibly exciting initiative and partnership. It's a little echoey. We've got about 4 or 5 domains that we're really going to engage in conversation about that we know from our organizational culture literature, implementation science, change management literature that are really important for kicking off and sustaining really important and meaningful system transformation. Talking a lot about leadership, right? We know nothing important, nothing meaningful ever happens without really strong leadership, and to get a sense of what really is the vision and energy and passion that's driving these collaborations within these jurisdictions, and how we really got started. I think what we're going to talk about today will also translate to the table activity that we'll do after this, and really see about how some of these issues are manifesting themselves within your jurisdictions. So in addition to leadership and how we're even getting this work off the ground, thinking about things like ways of working together. What are our teaming? What are our governance structures? What does that look like? How are we going to shift? We talked a lot about the change in mental models yesterday, and that also changes in how we think about the work we're doing, how we do that work, who we work with, what that looks like, who's at the table, and to get a sense of what some of these initial teaming and governance structures look like, supported by what's I'm imagining will be a really aligned vision between child welfare and TANF. I think one of the things, Claire did such a good job talking about it yesterday, it came up in many of the conversations, that we have these siloed and fragmented human service programs that have our own goals, our own outcomes, but really we're serving a lot of the same families, we're trying to accomplish a lot of the same goals, having a shared accountability framework would be so important for guiding that, and all of that starts with having really aligned vision, and we'll love to hear from folks about what that has looked like. And in doing so, how are we communicating all of that information, right? If we know anything about all of the systems change, improvement strategies, all of that I think we've been engaged in together over decades, we under-communicate. And how do we make sure that all of our partners are having the information that they need? How do we educate? How do we promote buy-in? What does that look like? And to start to hear a little bit about what some of that is looking like, quite early in the process. So those are some of the domains that we're going to talk about. I'm kind of giving you a preview so you all can start thinking about that in terms of your own jurisdictions. And I'm very excited to learn together this morning with Shelly, Lisa, and Elaine. So, Elaine, I'll start with you. What brought you to this conversation? Why did this child welfare TANF collaboration, how did it become a priority and something that you knew that you wanted to focus on in your work and in your partnership?
Well, part of it, the reason I'm here is from speaking from our home of the Chippewa Cree Tribe on the Rocky Boys Reservation in Montana. We're a small tribe. We're probably about 3,500 that live in our small reservation, and as everyone's been slammed after COVID, we've dealt with the students in our school system, and that's alarming. The students going back, even during the remote learning during COVID, it became a huge concern to us in our departments and the tribal council. The tribal councils are our governing body in our community. It's like we're our own little country in Rocky Boy. So in all of these areas, the absenteeism went up to like 80% last year. We lost a lot of students and getting suspended or expelled from school. And to me, then those kids come to TANF once they get to be that age and start having babies of their own. And then we were slammed with overdoses, from fentanyl hit our reservation, and suicide, which is extremely alarming because it's something that we've never experienced in that way. We value our life. We have the values that we hold dearly in, our Chippewa Cree way of life. So we were slammed with all of that, and in working with the council in our department, we didn't know what to do. What are we going to do? And And so, this came to my attention, the opportunity to network and find a way to keep our children from being removed in their home, which is so heartbreaking. And we can make a difference. We can catch those students if they're 5 days absent, and the students see or the teachers see what's going on. Let's get to them before any more time goes. Let's be quick about it. And so we're going to start our wraparound services and do the referrals to our department and work with our peacemakers. Our peacemakers were developed at a time when we needed the wisdom of our elders. So we have 2 peacemakers I work with, and I plan to have them come in and start the wraparound with the family, with the people involved, the school, tribal court, because they have the strong arm. The parents will have a choice. You either go to jail or choose to work with your child and your family. And let's get that student to school. Let's get mental health people there from the clinic in one strong case. And we can prevent so many children from being removed from their homes, which is so heartbreaking. But that's why I'm here. So, and we have to make this work. When our team, and we've started that with the help of Brittany, we can make this work, but it's only going to be as strong as we make it.
Thank you so much, right? I think what was so important in what you're lifting up is this culture of prevention and the interconnectedness. It was starting with absenteeism, the relationship to TANF engagement, the relationship to child welfare, the relationship to mental health, and thinking about how do we engage families early, how do we do that in ways that are culturally responsive, that are not, that are not, traumatic, and going through the peacemaking circles, and really trying to build a culture of prevention and bringing that dynamic and perspective here. So thank you for sharing that. Shelley, why is this work important to you? How did you become a leader in this initiative? Why is this a priority?
I don't know if this is maybe not working. Is this working? Okay.
Use your stage voice.
My stage voice. So I am just a highly collaborative individual in the first place. So I always enjoy working better. Things are always better as a team. When I got this position, it's a brand new business unit in child welfare. What am I doing wrong? I don't know. There's a green light. Now is it working? Do I need to just hold it? Highly collaborative, as I mentioned.
And she really receives capacity building services openly.
I am all about like this. Okay. So when I got this job, Janae, who is my division administrator, has a really good sense of humor. She actually is a stand-up comedian, if you ever get to meet her. But Janae's like, congratulations, Shelley. If this was a house, it would be a fixer-upper. And I'm like, oh God, what did I just do? So I started looking for ways at all of the things that we needed to do. There was no way that our skeleton crew could do them all themselves. And there is no way for us to make a big difference across an entire state without solid partnerships, both internally and externally. And so this opportunity came up, and I've worked with Matt before, and I've worked with some of the folks in community access before, and it was just, it had Iowa written all over it. It was just perfect. Like, great, this is a reason for us to work together. This is a reason for us to understand our work. And I'm just inspired by the people I get to work with, and yeah, I'm super excited that we're already making something new. Why not make something new really well?
And so really emphasizing that it's not like singular leadership, but that collaborative leadership is essential, and recognizing that there's already kernels of that existing in those relationships that are something to build on. That's super exciting. Lisa, what's your same question?
Okay,
Not everybody's
I'm
going to
ready.
get all the questions, but everybody's
Okay.
getting this question.
Okay.
Why are you here? Why is this a priority?
Yeah. So for us, for California, I should preface and say I'm a crossover. I started on the child welfare side, and a few years back, California, we were developing our Children and Family Services Plan. And for those of you in child welfare, you know that's like our 5-year visioning strategic plan, where we outline what our system vision is and what our objectives and goals are based on our data and what we want to do with our system. And so I was going about that process and looking at our data and recognizing that reunification was a problem for us, and started thinking about how we were going to solve that. And came across information of California's linkages effort that had been a federally sponsored effort many years back, and had sort of lingering legs out there, but really wasn't doing anything. And so I wrote into the plan, we are going to reinvigorate linkages, and we're going to do some great things like develop a unified case plan and things to reduce barriers for families. And I really didn't know anything about TANF. But I met my TANF partners in CalWorks, and now I'm here representing TANF because I switched positions and recognized that TANF is just such an opportunity to be it's our biggest child abuse prevention program. And so I thought, okay, well, I'll switch teams. And so I've got really great relationships with my child welfare partners. We've got super strong collaboration, but it all started from that thinking about how are we going to reduce barriers for families, support reunification, and even better, get upstream with prevention.
So did you switch teams, or did you build a bigger, more integrated team that's actually the same team?
It is the same team. It's the same team. I just have switched seats. But yeah, yes.
So what is and so sort of along this lines of like leadership and getting started, let's talk a little bit about the context in which you all are working and like how you even got off the ground and starting to make this a collaborative partnership. So just staying right there where you were and recognizing that you were even shifting perspectives. What was it about the context in California right now that made it seem like this is going to be a meaningful and successful transformation? How are you even getting started, and what is it about your environment that's setting you all up for success?
Yeah, great question. For California, I would say we had a number of strengths in the works for us to leverage. I mentioned our linkages practice, so that was something we could build on. We had also implemented child and family teaming on the child welfare side, and so we had this teaming and collaboration mindset, really centering family voice, and we were also building out a system of care. So kind of thinking about the partnerships and what it looks like for a family to navigate various systems, and how we could do a better job as systems partnering to make it easier for families. And then our leadership. We have really fabulous leadership. And if I'm on Zoom right now, I just want to call out and say our director, Kim Johnson, is amazing. She is such a champion in the work, and she shares her own personal experience of having been a young mom and being part of home visiting as a young mom.
That was Lisa. That was her coming in to.
Oh, stop right there. Anyway, so we have a lot of great leadership support.
Great.
Yeah.
Elaine, let's go back to you for a second. So you're talking about identifying, really starting to see some of the issues with absenteeism and recognizing that there were opportunities. How did you get started? Like, what were the first, because I think sometimes we're all kind of overwhelmed when we see these challenges and we know we need to work together in a new way. How do we even get off the dime? So what were the very first things that you did to start pulling partners together or thinking about your plan or your strategies? How did you go about doing that?
It's always been there. I've been the TANF director for 19 years. Hard to believe the time has gone by so fast. But we're so busy at TANF, you know, this always comes up, the collaboration or the strategic planning. And we're always looking for ways to network and bring our people together. We're very fragmented in our small community. You know, it's like we could be living in another state for as much as we work together. And that's the challenge. So in bringing those people together, we've been trying to staff once a week with social services, so we can catch the most at-risk families quickly and keep ourselves updated in what's happening in our community before the children are removed, or there's things that we can do. We also are part of the Wellness Coalition, and they're the overall board in our community that address activities in some of those areas that we're all involved in, like the Red Ribbon Week. TANF is kicking that off with a community breakfast. It's huge, you know, but those are things, and then we have people come in and sign on a big strip of red paper, you know, I pledge to be drug-free, but all of that is awareness, and we need to bring that awareness to everyone. We don't have a system to get the information out to people as to what's offered there. We have so many departments that have so many cool things going on. We just recently, the clinic just smudged the res. Smudging mean, you know, our purifying our homes ourselves in a daily good way. And so, the clinic went and smudged each village, which was really powerful in helping the whole community. And so that networking is so crucial. And when I go to like this, you know, we don't know what we're all doing. So we're all educating each other in how we can make this stronger. Everyone's willing to do that. We just have to figure out how to sit there and talk to each other. We also have the support of our governing body, like I said, and it was really cool to have the chairman say good morning this morning. I really like that, you know, to have that empowerment to me to say, you know, this is where I'm at, and we can do this.
It's incredibly powerful to have like that, the historical strengths, the community ownership, the you know, the investment and buy-in and support of leadership, and just building on all that is there to continue to move forward is really inspiring. Shelley, you said you come to this work with a naturally collaborative spirit. How are you like leveraging your strengths, leveraging that spirit to work towards an aligned vision with your TANF partners? Have you gotten there? Are you working towards that? What's the process like of establishing shared goals and shared vision for where you want to be a year from now?
Well, the good news is it really hasn't been that hard. I think that while in our first meeting with Ella, for instance, folks were really learning a lot about child welfare from the community access side. And there were a lot of, oh, I didn't know that. And also on our side, from the child welfare side, back to community access, you have a what? How long is that assessment? Like, where does all that information go? We need the information. They're like, oh, actually, can't share it. It's like in a PDF and we can't. It was just like this, wow, these things have existed under our roof, and we don't know what we don't know, and we haven't until now even asked. And I think everybody in the room just is ready to learn more, open to talking about, and I think I've said a few times, what just isn't working for us, and what really isn't working for our families. And so that was the other just broad agreement that we're going to start not talking about our programs. We're going to just talk about families right now, and I've also done that with my own team. We're not going to talk about home visiting and early childhood and all the things. We're just going to talk about families, because if we talk about our programs, we'll get crossways super quick. And then all of the barriers will come up. Well, here are our qualifications for this program. Here's the data we collect. These are our outcomes. This is our favorite stuff that we did. And those are all awesome. But just recognizing we bring that to the room. And then, we also recognize that there are people that receive those services that are really the most important part to focus on. And so I love that my teammates have agreed to have those discussions that way. I appreciate that Ella's agreed to lead us through those discussions that way. And I think we're all likely to carry that back to our own teams and continue those dialogues, the dialogue that we have together, continue that and sort of scale and spread that throughout the agency.
Have you noticed any shifts that have occurred as a result of changing how you're holding these conversations? Has that resulted in tangible changes in either programming or how folks are working together? What's been the impact of that pretty profound adaptive change in your way of working?
It's a little early. We're pretty early.
I mean, it's like 9:30. It's not that early.
Right, yeah. It's kind of early to ask that question. While it's a little early, like already in my world, I had our CBCAP TA provider in for a couple of days last week, and I had my team members there and my division administrator, and everybody was there, and I'm like, wait, we're doing this TANF learning community, TANF and child welfare learning community, and we're planning on surveying families and asking certain questions. Why are we resurveying families? Why are we doing so? Already it's like we're landing in a space like if we're going to do this work, this is going on, and like continually elevating. This is a way that we're collaborating in this space that is very meaningful, and how do we all attach to that? And so that's probably a very early lesson. I'm really looking forward to the survey because also there are some things that are going on around our state related to like guaranteed income and different pilots that are going on in private organizations or community-based organizations that I think now we have a way to connect more meaningfully to those projects and also start a dialogue there. So again, I'm highly collaborative, so everybody is my friend.
Last question for you, and I'll let you off the hot seat for a minute.
Okay.
Technically speaking, have you guys formalized the Child Welfare TANF partnership through any memorandum of understanding or any kind of formal protocol?
We have not, and I don't see a universe where we will need to do that under our new structure of the super agency that we are. I don't say that in like a Superman term, but that we have 7 agencies under one roof. So I don't see that happening. I see MOAs or MOUs maybe needing to happen with other state agencies or maybe with community partners, possibly. What I think will be probably more likely is the data, like as we look for data to tell stories, that we're going to have data use agreements and things, even just internally. How we share data across divisions is still a question as our agency matures. So that, I think, will be the most formal thing we'll need to do right now.
Lisa, sort of same question for you. I mean, because California, so big, county administered, right? There's a lot of uniqueness to trying to do things in California, to put it very, very lightly. How is that showing up here? Are you needing to do a memorandum of understanding, or how are we like formalizing these agreements? Does the state-county issue come into play in this? What does that look like in terms of establishing kind of a structure around that partnership?
I think it's on, yes, okay. Yeah, so I mentioned our CFSP, and so we kind of have the linkages idea, the collaboration idea across child welfare and TANF documented in a federal
CFSP,
document.
June 30th, if y'all aren't working on it, you very well should start. Get your partners at the table, minor PSA, carry on.
So we've got it documented there, and we've got some built-in accountability with that, which sometimes is a good thing. In terms of our, between our programs, we don't have any formal agreements, but we have documentation of what the partnership looks like and what various components of that look like through the linkages work. And I'm looking at Melissa because she is with our Child and Family Policy Institute of California, and they have been a longtime partner, community partner that helped us build out a toolkit for our linkages work. So there are a lot of resources and best practices, and so there's actually quite a lot documented.
Right. Great. I think it's really great to use those established planning mechanisms as an actual guide for memorializing, concretizing, building up some accountability, documenting it, and then having that as a resource. I think that's really smart.
Yeah, we also set up some structures to go along with that. So we initially, when we were sort of kicking off our work or reinvigorating it, we put together a working group, and so solicited support from our county association and various county partners to be a part of that, and made sure that any county that was participating came with, both sides of the house, if you will. Once we kind of got through the work group part of it, of what did we actually need to create, then we established a steering committee. And so we kind of have some of that governance built in. And I'd say it's still morphing, but we at least set up something to build from.
Yeah, and that was a beautiful segue into where I wanted to take the conversation next, is around what does that governance look like? What does that teaming look like? So Shelley, why don't we pivot to you for a minute? Now that you've gotten kind of the vision and the folks around the table, how is that showing up in teaming and governance structures? Is there a steering committee? Are there implementation teams? Where are you in that process, and how are you thinking about that in Iowa?
Well, again, it's early, Ella left on a Friday, and we met again on a Monday by ourselves, and so it was really important that we establish, continue that momentum, and so we're meeting again this coming Monday. I think we'll meet a couple of times a month. I don't know that bi-weekly will be enough at some points in our project. I think sometimes weekly will be too much, and so I think we'll probably, in order to have more bandwidth, there are 5 core team members and 2 division administrators. So I think we'll probably need to add more folks as our projects mature. We don't have a charter. Maybe at some point we would need one. And as I thought about this, we established roles and responsibilities in that first meeting, and everybody just was really willing to do the thing that they're good at. And so that seemed great and just easy. But how we communicate this project up to the level of the director of our agency, we probably are going to need to establish something like a charter that would say, well, this is how we've chosen to work together. These are some of the products that we're thinking about, et cetera, so that the message can be carried forward, and we can make sure that everybody's sharing the same message as the project matures. So I would say that we're really, without a lot of structure, I think there's all kinds of possibilities. We did establish a team site where we can hold our documents, share our documents, and make sure that we'll loop Emily and Ella into that yet. And then also that's a great way for us to interact, as we're a small team, in order to massage documents, wordsmith, that kind of stuff.
So if I understood you correctly, right now you got kind of a really tight core team. And are those primarily state agency staff across both departments?
Yeah, they're just state agency staff. There's potential for others.
Yes. I know it's early.
Yes.
But is there plans to think about how to engage external partners in this teaming process, really maybe thinking about elevating lived experts, recipients of programs. Any preliminary thoughts on what that what that will look like or what it could look like? Has that come up yet?
It hasn't really come up yet. I would just say that we're very open to, we definitely, if we're really focused on families, we're going to want to talk to families, and we will want to engage also folks who provide services to families directly. So getting closer to the work, I think, is something that is a value for us. We realize that we're not as close to the work and don't have all the answers. And so continually being curious and seeking answers from our stakeholders will definitely be part of our project. We just don't have anything formal yet.
Yeah, great. It'll be exciting to see how that continues to evolve.
Yeah.
Elaine, how does the teaming or the collaboration show up in your community? What does the work look like? Who's around your table? Is that formal or informal, or how are you approaching that?
I've been thinking about that. We brought it up very recently about all the meetings that we all have to go to, and trying to figure out how we can, double up on maybe some of the meetings that we do attend, and then in all the work that we do, people think, oh, here we go again, another project. So, it's really important that we start this with a really simple fact sheet and good information to catch people and get their buy-in with that core group. This is a really important part for us to get that core group together on how we're going to get this started. And weekly, we can do this on the important parts of our work, and probably twice a month. And we can look at it and just see how that's working. But right now, I don't really see a formal agreement. Sometimes people are hesitant to sign off on agreement because they're not sure about how they're tying themselves into whatever we're doing. Sometimes, it gets to where we don't know who to trust. And so at this point, it's important for us to talk to our people and go to the superintendents of the schools. It's important for me to go talk to the superintendents of the school and our governing body, the CEO at the clinic, to have them see what we're doing and to gain their trust that we are just not another program we're just kind of wasting time on. It's important to get that core group and get the support from those departments.
Right, that's fantastic. The last thing that I want to talk about our last 10 minutes together is really around communication. I know it's super early in this effort, but we'd love to get a sense of how you all collectively are thinking about communicating what you're trying to accomplish, both internally with staff and folks, and trying to think about the mental models and things we were leaning into yesterday that we want to change, or that we need to change in order to create a different way of serving families, and also communicating with external partners, community leaders. Lisa, how are you guys starting to think about communication? What's happened to date? Do you have any preliminary ideas about what that might look like, what mechanisms you might use? Where are you guys in your thought process and development?
I'll stick with the it's early theme. Am I on? We've had some preliminary conversation about what we need to message, like what looks different as part of us being in the Fast Learning Collaborative from what we had started under linkages. And so for us, I'm envisioning that it might be more of maybe it's a focusing of our effort. So getting really clear about what it is that we intend to accomplish, and making sure that resonates with our partners. So I think that part, we need to do some more engagement,
Mm-hmm.
like make sure that the goals that we've established as part of our committee actually resonate and hit the mark with our larger community. And then I think messaging out what those specific goals are, what we intend to accomplish, and how folks can, be part of that, support that, learn more.
Mm-hmm.
So early,
Early.
but that's my thinking.
So, Shelley, it's early.
Yeah.
How are you thinking about communication?
So we have in Family Wellbeing and Protection, we have been assigned a person from our communications team,
Fabulous.
Miss Claire. And Claire is really eager to engage the public and engage folks across HHS. I believe Community Action also has a communications person, but I can't be sure about that. So we would share Claire. And I think getting very clear about what it is we're doing, but what problem are we trying to solve? What are the goals? What do we expect to happen? I think I agree there that we need to carry that message forward, something very simple that everybody can attach to, hopefully. And then trying to think about what does the public-facing communication look like, and what does our internal communication look like. In the past, with bigger projects, we've set up a website that folks can go to and they can see all of the different outcomes of a project or an assessment that we're doing. That might be something we could do. And in the meantime, if we also use our communication person to engage families, Claire has been working with me on a different project to send out just quick polls via social media. Here's a question, what is your answer? And we're just testing things to see what we can get back from social media as well. It's not my favorite form of communication, but it is definitely one that gets attention. So more to come on that, but a communication strategy is definitely needed.
I, for one, am looking forward to the TikTok video series for your project.
That will involve Ella doing a quick little dance that everybody can emulate. Can't guarantee I will be doing that, but we will enlist someone to create a TikTok video. Yes, thank you.
Elaine, what is the communication about this collaboration? What does it look like in your community? What's in place? Are there new things that you're thinking about? Are there existing communication mechanisms or ways that you reach one another that you're thinking to build off of? Where are you all? How are you thinking about communication in this effort at this point in the process?
Communication is so crucial. The simpler, the better. Even in-house, when you have staff meetings, we were just talking about that. Staff meetings when people sit there and we don't know what's going on in their minds. Are they really listening? Do they understand? I kind of second guess myself. Am I communicating to where people understand what I'm saying? So I need that feedback for people to say, is this what you're saying? So it is so important. I can't stress how important communication is in our community. We don't have a newsletter. The fastest way to get information to people is by Facebook. Everyone has a device and everyone's on Facebook, and that's the simplest way to get information out. And we need to use that vehicle in a really good, positive way. Daily announcements to people on what we're doing in our department, the TANF program, because we're the frontline workers. So positive messages all the time. In the meetings that we go to, we have a staff person that's on a school board. So that connection to the school is so crucial. So the messages that we have our foot in the door there with her being on a school board. We have another one on a wellness coalition. How they represent what we're doing is so important. And to get those fact sheets, get meetings together, or we have support meetings, and we have the flexibility as a tribal TANF program it's so cool to be a tribal TANF program because we have the flexibility to do what we want to do. And it's really been great. And, you know, thanks for Janelle. You know, she's always been so supportive in the work that we do, in the cultural language history that we do. You know, it's just wide open on what we can do. The key is getting that information out to everyone. And when I do talk to people, when they take the time to understand, you know, we get good feedback, and people are looking forward to what we're going to do here with the wraparound services. It's encouraging.
And yeah, and you said so many important things in that last sharing, right? And how important it is to have straightforward, clear messaging.
Yes.
You know, I think we can often get, and I think we talked about this a little bit earlier, Shelley, too, when people get caught up in the own complexity of our programs and the complexity of the work and the nuances of family dynamics. But to achieve a change like this, we need straightforward, clear messages, consistent, repeatedly shared. And to continue to think about that with great intention, I think will be so important in this shared effort. So to wrap us up, and I confess I did not share this question ahead of time, so please don't panic. But in the spirit of communication and clarity of message, at this point in the development of your process, what would you share with our learning community about what you most want to accomplish? Like, what's the key message that you would ask folks to walk away with what you want to accomplish and where you want to be in this program a year from now? Is that something that feels like we're at a place to share that and start to work together to come up with clarity and refining our message? And so I'll pause and let whoever wants to go first lean into that space.
You know, I'm an educator too, and outcomes are very important to me too. It's like my grade sheet. Yeah, so I'm looking forward to the work that we're doing, and to show the results to my supervisors, the business committee, and to the schools, one family at a time, one student at a time. If we can be successful with that one student and being there at school for this month, and be successful for the school year, that's my benchmark.
In a year, I think we have a lot of internal learning to happen, and I would expect that in a year we'll have a plan to impact families. But I think more importantly, we'll know more about each other's programs. We will have made some adjustments that are internally, that increase our efficiency and our effectiveness inside the building. And I say a building, by the way, we don't have any buildings. They are renovating our buildings, and we are all just wherever we are. So the figurative building. And then I think also what I expect and what I would love is to understand what doesn't work, but also remember that some things that we do actually work for families, and that some families are helped by our services, and we can just capitalize on what is working. So in a year, I hope that we have a grip on that.
I love the question, and we spent time yesterday as a group, a small group. Obviously, not all of our team was present for that, but talking about our results. And we have a laundry list of things that we hope to accomplish, and a year is not long, especially when talking about a very large state and the dynamic of 58 counties. That operate with a lot of autonomy. And so with that being said, right now we have 28, 30 counties that are part of our linkages effort. We hope to increase that number significantly, and also get really clear about what the fidelity, what it means to be part of this collaborative effort. And I think we came up with a lot of questions that we need to answer. So that's going to inform kind of where we take our results work. But we've got a lot underway in terms of understanding our take-up rate for TANF, who is being served and who is not, and figuring out how to reach them really is a prevention effort. And that's going to have some downstream effects for child welfare. So those are some of the many things that we hope to delve into over the next year.
Awesome. Thank you. Well, I hope everyone will join me in thanking our terrific panelists and leaders.